Welcome back to West New York Living. Now, speaking from experience, it's very easy to take some things for granted when you're young, but as you age, it becomes more important to understand how simple tests can help your overall health. This morning, happy to have with us again Dr. Jill Bernstein from Hearing Evaluation Services of Buffalo. Good to see you, Dr. Jill.
Nice to see you too, thanks.
All right, let's talk about the connection between hearing and overall health. We hear it in dental, right? Your teeth and overall health. Tell us the connection with hearing and overall health.
There's a lot of research and some that just came out again supporting it, but a lot of common medical conditions actually put you at higher risk of having hearing loss. Things like high cholesterol, high blood pressure, thyroid disease, type 2 diabetes. But then when you have untreated hearing loss, that also puts you at a significantly higher risk of developing cognitive impairment, anywhere from a 2 to 5 times increased risk level.
You know, I think folks are accustomed to, hey, the annual dental checkup, or you should go twice a year, by the way, eye checkups, but maybe not hearing evaluation. Right. How often should folks have their hearing evaluated?
Well, once you hit 55, that's when we say you should start having your hearing checked at least every 2 years. If you have any of those other risk factors like cardiovascular disease, hypertension, things like that, then we may actually recommend having it done annually.
Now, before 55, what are some things folks should be keeping an ear on, pardon the pun, to come in earlier perhaps?
The most common signs that your hearing is changing are things like, I hear fine, but this person mumbles or that person mumbles. Mumbling tends to be a sort of a side effect of high frequency hearing loss. And even though it might seem mild, even that mild high frequency hearing loss will double your risk of cognitive impairment down the line if you don't treat it. So it's why it's so important that even when you don't really feel like there's a big problem, that you get in and get it checked, because sometimes you just don't realize it. And we say it's like other health conditions. You may not feel sick when you have type 2 diabetes, but there's a lot of things happening under your skin that's causing damage whether you want to address it or not.
And ringing in the ears, another sign, tinnitus.
Yep, ringing in the ears, turning the television louder, turning your cell phone louder, all those things.
Now, we saw some of the video there too. There's plenty of options now. If someone has hearing loss or is losing their hearing aids, they're so advanced now, and there's so many different sizes. It's not the satellite dish Grandpa had when we were growing up.
Yeah, I mean, we have truly invisible hearing aids that are worn 24 hours a day that nobody will ever see. They're right in front of the eardrum. 2 more traditional types that go over your ears. We were just at a training for the most recent release of a pretty revolutionary product from a company called Phonak that has actually dual chips, onboard artificial intelligence, and is showing really positive results with particularly hearing and background noise, which is what most people are complaining about.
All right, final thing, as we mentioned, if you're 55 or older, every 2 years to get that checked. It's a no obligation hearing screening, correct?
Absolutely.
They can call and schedule?
Absolutely.
All right, this is something that we've got to take care of here, our hearing. If you're noticing changes in your hearing, it is time to schedule a no obligation hearing evaluation with the wonderful doctors at Hearing Evaluation Services of Buffalo. They have 4 offices across Western New York, so you can find them in Amherst, Williamsville, Orchard Park, and Tonawanda. To find out all the hearing services they offer, head to their website, hesofbuffalo.org, or give them a call, the number you see there on the screen.